We always try and use the smallest instruments in the ureter as we can, but equally we want to try and keep the pressures low, keeping the intrarenal pressure low, which allows to keep the fluid in the kidney cool. My name's Oliver Wiseman. I'm a consultant urologist working in Cambridge in the east of England. I've been a consultant for 17 years now. I specialise in endourology and undertake complex percutaneous nephrolithotomy and ureteroscopy. I undertake approximately 100 ureteroscopies, and they tend to be in complex patients, so in patients who have got reconstructed anatomy, who've got horseshoe kidneys, maybe transplant kidneys, so really the more complex type of surgery. And it's really important that you've got an armamentarium of different endourology tools. I've been using the HugeMed flexible ureteroscope for probably 2 to 3 years now. It was a small caliber, which meant that I was able to access the kidney for the majority of my cases. The vision's excellent, the image quality is really, really good. The torque transmission also was something which was very reliable. More recently, I've had access to the 6.3 French HugeMed flexible ureteroscope, and I would say that from a point of view of image quality and utility, it's exactly the same as the 7.5. But particularly if the patient is unstented, or you know they're going to have a tight ureter, maybe because of ethnic background, maybe because of problems accessing the ureter before, and certainly starting off with a 6.3 French scope I think would make sense. I haven't really found any difference in the way the scope performs compared to the 7.5. So I think very quickly the 6.3 is going to be my go-to scope for all cases. We know if we look at the size of the ureter that in about 1% of cases you won't be able to access the ureter in the UK with a 7.5 French scope. So I think that having the 6.3 French scope when you think that access might be difficult is sensible, and or having it as a backup when you can't access it with a larger scope. We always try and use the smallest instruments in the ureter as we can, but equally we want to try and keep the pressures low, and so you might say we're downsizing our ureteroscopes, but then we're choosing to use an access sheath at the same time. How can that possibly make sense? Well, if you use an access sheath, that's got significant benefits from the point of view of keeping the intrarenal pressure low, which allows sufficient irrigation. It allows you to keep the fluid in the kidney cool, and will allow you to maintain your visibility as well, and also suck out some fragments with a suction access sheath. So for me, using a smaller scope is something I would always try and do. Smaller scope, if you're using it with an access sheath, means a smaller access sheath as well. But really miniaturizing our scopes is going to mean that we can access all of our patients. When thinking about which company's equipment that we use, I think it's also important to consider various other aspects. The first that I would say is it's about feedback of the equipment that we use, and maybe we think of technical improvements which could be made, which would improve the product which we're using. And I would say that the HugeMed team have been responsive in that regard, and have been quick to innovate to using their equipment better. So I've been impressed. I must say also from the point of view of innovation and what they have coming on in their pipeline, and it's generally a really exciting time in ureteroscopy. And I know that HugeMed are also going to be a part of that story and that journey. And HugeMed are investing in education so that we can pass on our tips and tricks and knowledge to the next generation, so that they can continue to innovate in this space. So overall, those are the things which I would look for, and I've really enjoyed working with HugeMed over the last couple of years in those regards.